75, 56 for low tonight. Tomorrow, sunshine with a high of 80, and it looks like it's clouding up. I still say that's fog out there, though.
No,
Doctor?
there's no fog.
No? What do you think, Doctor? Does that look like fog rolling in?
When I drove in, it was not cloudy, but you could see it might be a little bit of fog because you could see it just right in here, and it's rather humid out. But I'm not a meteorologist.
No, you're a professional, of course. Relf Eye Care Center. How are you doing today, Doctor?
Good, good.
We are talking multifocal contact lenses.
Yes.
It's a mouthful. What exactly, in layman's terms, is that?
It's a contact lens that allows you to see distance and near without having to put reading glasses on. So right about 40, most people start to have trouble seeing up close, and they just think, well, you know, if they've never worn glasses or contacts, they think they're sentenced to reading glasses. And really you're not. I mean, most people can be fit with the contact lens very successfully, about 70% success rate for using these types of lenses.
Are people stubborn when they get to 40? Because I know, actually, one of my buddies here at work, he has to use the bifocals, and he wore them like for 2 days, and he's like, I'm on.
Yeah. I like to wait until people are very symptomatic or sort of resigned to the fact before I do prescribe a bifocal, either in glasses or contact lenses, because it's an adjustment. Your brain has to figure out just a little bit different way to see. And so, you know, unless you're really ready for that, it tends to not work. Yeah, so with these, they've been around for about 15 years or so. The first ones, you know, of course, just like anything else, weren't great. So people who've tried bifocal contacts 8-10 years ago, it's completely different now. We even have, you know, if you have dry eyes, we have one-day disposable multifocals that work really well, and those stay very comfortable. And, you know, the contacts present distance and near images to you at the same time, and then your brain figures out which it wants to pay attention to. And it gives you about 90% of everything you can see well. You can see your computer, you can see your cell phone. I used to do reading cards to check to see near vision. Now I have people take out their smartphones and just make sure they can see to read. And that's just wonderful. You know, if all of a sudden you can't see your phone and you're holding it out or looking for readers to check messages, it's terrible. So it's been really nice, a nice option for people.
What's the first step? If people are interested, what's the first step in looking into these?
You know, usually a good eye exam. If you haven't been seen for a couple of years, you'd want to do an exam. If you were seen 6 months ago but would want contacts, all we need to do is a fitting, as long as it's within a year. And the fitting process is important. There's a little more art involved in fitting these. They're different. There's different optics, different brands. If you do, you know, if you're working on 3 computer screens, we'd fit you with something different than if you read books all day.
Cool. And if they want to get a hold of you guys, what's the best way to do that?
You can give us a call, 720-3553. You can also visit our website, relfeyecare.com. You can make appointments there through the website. And then, of course, we have a Facebook page as well.
Easy as that. And I suppose right now, kind of busy, kids going back to school again.
Yeah, it's been pretty busy, yeah.
Keep that in mind, parents, too, to have, you know, eyes checked before school starts.
Yep, and don't wait till the week before school.
Right. Right. Thank you, Doctor. Of course, Relf Eye Care Center. It is 7:39 here on the New Morning Show on Nu92.